Hi, welcome. It's me, Dr. Khaled Sadek, and you're watching another episode of live chat discussion on my YouTube channel. If you're new to the channel, welcome on board. This is Dr. Khaled Sadek Uncut, where we do mostly talking about the videos that we release on the main channel. So it's very much a behind the scenes director's view of all the stuff that we've been filming. So I'm so glad that everybody joined us on the last chat where we were discussing the cyst. I think it was on the lady's face. It was part of our face cyst series where we were covering as many epidermoid cysts on the face, and that including the eyebrow, the massive gob smacker on the jaw, and the cheek cyst as well. I thought we'd have a little break from the face cyst series. We'll go back to that next week, because we have to interrupt this because we've got this rather enormous cyst. And when I mean enormous, I mean massive. And you know how massive cysts get. Well, this thing was huge, absolutely huge. It was almost the size of an orange, and it was sighted just here on the forearm. So I thought we'd bring that to you because it looked like a lot of fun. We had a lot of fun removing it. So we're going to bring that next. Remember, if you don't know already, we are on Facebook. It's a new page, Dr. Khaled Sadek, as well as the Twitter and Instagram. These chats are going on every Wednesday, Friday, and Sunday at 9:30 p.m. GMT time. So you've got to work that out wherever you are in the world to make sure you kind of cross your time zones accordingly. Let's say hello to everybody. Let me know what you thought of the last video. Let me think what else you want to ask. Just think about all the questions you want to ask me. So have a little think myself. I'm going to go do some hellos. We've got some people already tuned in. So let's go over and say hello. Let's have a look. Who do we have here? Let's have a look. So we've got Prince of Zam. He's saying hi. Caroline Tom, she is saying hi. Gibby's wife is saying hi. Dr. Sarah's in the house. Christiana's in the house. Lorraine is saying hi. Gail from Texas. Marion is saying it's pretty rainy in Scotland. LaDonna, so glad to be back. Lovely. Sulalali from the United Kingdom, she loves our videos. Bridget Schumacher, Iron Man. What is the reference going on there? From Cleveland, we've got Joyce. We've got Caroline Meyer in the house. We've got, who else do we have in the house? We've got Patty. We've got Sandra. And we've got Gail from New Jersey. Welcome everybody. So, hope everybody's well and remaining safe wherever you are in the world. In the next clip, we had a lot of requests about doing some outside filming and some filming in the garden as well. I know that a lot of our viewers are keen gardeners with very, very green fingers. So I thought I would introduce you to some of my garden and the plants that I've got growing. And and you know, if you've got plants which you like and you want us to show them on the next video, then don't forget to send them to me, you know, on lipomacyst.com, contact@lipomacyst.com, or Facebook it or tweet it, whatever you would like to do. Bring that over to me whenever you like. We've also got some blackheads. I know everybody saw the teaser on Instagram and they really would like us to release that. So that's probably going to come out next week. We've got some mucoceles coming out. Those are cysts in the lip. We've got some lipomas. We've had lots and lots of epidermoid cysts all over the face, sort of in the T-zone. And we've got face lipomas as well, forehead lipomas, real tricky ones as well. Those are coming up next in the next couple of weeks. So make sure you tune in. So why don't you tell me where you are, what you're doing. If you've got any questions, ask you know, freely. We've got a few more minutes before we go live to the next massive release. So let me know what you're thinking. Let's go back to the board. Let's see what we've got in town. Let's have a look. So where were we? Patty, Sulalali. Tell us about the new vaccines. Are they coming out? Well, might do that. Light on my chest. The lights are very bright today. Absolutely. We need to draw them back a bit. Can't wait. Gibby's wife, how are you doing? Sandra saying, I look forward to seeing your videos. And Sherry from the United States is saying hi. What else do we have here? We've got, do I like the smelly cysts? Not particularly, not particularly. You can have POTS. Marion says, Dr. Sadek, you're a very genuine, caring man. The world's a better place, and we like you more for it. Thank you so much, Marion. That's very kind. Indiana is very hot, apparently. Gibby's telling us that Indiana is pretty hot at the moment. Lorraine, how are you doing? So true, Caroline had a few of these. I think you guys talking amongst yourself. That's fantastic. Joyce, could she feel that cysts from inside the mouth? It was so big. Yeah, you probably could. Yeah, absolutely. If you put your finger inside the inner gums or the inner cheek, you can kind of like squish it between both fingers. Definitely. Even if it's on the surface, you kind of like move your tongue against it, you will be able to feel that, absolutely. And, you know, a lot of the patients we're seeing are coming in, the cysts have been on there for about 5+ years, and really there's no need for that at all. It's very disfiguring, knocks people's confidence, and so the main aim of these videos is to sort of get the word out there that, you know, lipomacyst.com is your one-stop shop for cyst removal. So if anyone's got any issues with cysts or lipomas, then have a look at the videos. You'll see that they're all very short, 10-15 minutes maximum. That's all it takes. So don't leave it 6 years to have a 10-minute procedure. That's in the right hands, of course. So, you know, watch the videos, share them on Facebook. It's really, really useful to share the videos on Facebook. If you see any of our material being distributed under anyone else's name, then let me know. I know a lot of people have spotted material popping up on lots of other YouTube channels, and we've gone and kindly asked YouTube and Facebook to remove those for us, and they've done so. So if you see anything like that, let me know as well. Let's see who else we've got in the house. Let's have a look. Can you tell if a cyst is smelly before you make an incision? Yeah, you usually can. The smelly ones, the skin has broken down, and so the bacteria has gone in, and it's all started to become a bit necrotic. You know, as if you've left something out, it's gone off. On scarring, well, you know, I think when you do surgery, there's always a balance between the benefit and the risk. And you're not going to have any surgery without scarring, because invariably when you cut the skin, there is a scar. And the size of that scar will vary depending on the size of the cyst or lipoma. And so getting it done earlier will mean you have a smaller scar. There are techniques to make the scar less visible, but there will be a scar. So that's something to bear in mind. And so what I always tell patients is that if the cyst is very, very small, and it's, you know, almost negligible and it's not noticeable, then the benefit of having it out probably doesn't outweigh the scar. However, if it's on the face, it doesn't take a very big cyst or a very big lipoma to sort of distort the contour of the skin, and the lighting and the shadowing just makes it more apparent. And so in those cases, even small cysts or lipomas need to come out. Scarring is always a risk. There's a couple of risks involved with any type of surgery, from cyst removal to heart surgery, and that's scarring, wound infection, reoccurrence, bleeding, and bruising. So those are 5 risks associated with any cutting of the skin in a surgical procedure. So good question. Scarring is a risk with anything. Lots of people come to me and say, can you do liposuction? Can you inject it with these substances that will lyse the fat for lipomas? You can do, but I always find that those particular lipomas, they will grow back. The liposuction doesn't take the whole thing out, if you know what I mean. While if you make an incision, we can take it out, as opposed to just try and mash it up. That's a good question. Let's have a look. What else do we have in here? Caroline saying, if you understand the social distancing rules in the UK, so do you understand the social distancing rules in the UK? I mean, it can be a bit confusing, to be honest. Is it 1 meter? Is it 2 meters? Is it face masks? Is it not face masks? Is it washing your hands, happy birthday, not happy birthday? I mean, lots of things are changing. Things are changing almost on a daily basis, and it's been like that since, I think, early March. uncharted territories. We're still learning, and even today, as most countries are coming out of lockdown, it's an evolving process, and that's why it can sometimes feel confusing, especially in a country like the United Kingdom. We've got three nations under one sovereignty, and each one is kind of doing its own thing. You've got England saying it's all good to go to pubs, Wales, Scotland saying we're not so happy. So there is some conflict of information there, and so patients invariably, or people, will get confused if there isn't that unified message going across. Yeah, so absolutely, very confusing, Caroline. Bridget, does that mucus have to do with canker sores? Tell me a bit more about that. What do you mean? What do you mean by that? Sherry, do the patients you put on the videos get free treatment? It depends. It depends in which setting they're in. So we run a dual service. We've got NHS services and we've got private services. The NHS service is a state-run facility, and so treatment there is free at the point of delivery. So in those cases, yeah, treatment. I mean, it's not free. I mean, you pay taxes, and taxes will pay for services that the government do provide. At the end of the day, something is paid for, whether it's government or the individual. The main thing is that the videos are very much educational. They're there to make people aware and get the word out that the treatment is straightforward. It's to do some myth busting so that patients can kind of come in and say, look, okay, I've seen the videos. A lot of patients do. I think when we first started these videos, people were just coming in to get the procedures done. And now more often than not, patients have seen the videos, and then they come in and say, I've seen the videos, it's like this, I know what's going to happen, and it kind of helps everyone move along nicely. Of course, we don't film everything that we remove because, we do more than one pop a day. So yeah, there's lots of material that is being used. Let's have a look. Next question. Sue Lally, I like your videos because they're full of positive energy to everybody. Well, Sue, it's viewers like yourself and all the hundreds of thousands, not millions, actually 30 million viewers all around the world who sign in and watch our videos and continue to support our pimple popping community. You're all fantastic. You're all great friends. We're all great friends, even though you're all over around the world. But only 11 likes. So why don't you support me and give me some likes? Come on, hit that like button. Let's go next. Oh, no, who's on here? Belinda from Cologne. When can we buy merchandise? I don't know. I need to check. I can't. I don't know. I'll have to check about that. Caroline saying, you're very caring and I love your videos. Caroline, that's most kind. Lorraine, I have a lipoma in my neck. No pain, no. Not doing anything with it. It's not a bad option. Lipoma, whereabouts? Is it the front or at the back? Let me know. Gibby's wife, I have to say, thank you for educating us about these bumps. I believe the first thing you think of when you see a bump is, of course, cancer. What do you do? What you do helps for so many of fret and stress. Yeah, I think you're right. I think anyone developing a lump or a bump is going to think, oh gosh, there's things growing out of my body. What is it? Can be very, very scary. And these are myth-busting videos. Cancer is obviously like the worst case scenario, the one in a million. Most people just have cysts and lipomas. Common is common, rare is super rare. Next up, let's have a look. Is a sty the same thing as a cyst? It's a good question. So a sty, for those who don't know, it's a little bleb in the eye, otherwise known as a chalazion or a Mabian cyst. And those are cysts in the eyelid that help to keep everything lubricated, like in the skin. And so when they do get blocked, yes, they are cysts. Cyst just means a sac that can produce exocrine secretions. That's secretions that go outside the body as opposed to endocrine secretions. So these cysts can get blocked, whether they be Mabian cysts, styes, or epidermoid cysts, or pilocysts, or any other kind of cyst, the Bartholin cyst. And those cysts can even be inside. You get ovarian cysts. Yeah? And so those cysts get blocked, they keep growing, and boom. If that gets infected, then it's an abscess. An abscess or an abscist. So Marion saying Scotland has different rules than England on social distancing. Absolutely, it's so very, very, very confusing. Bridget, in the mouth bumps. I'm not talking to someone else there. I need to wear masks when I attend hospital for dialysis. Absolutely. Sue, hi doc. I need a T-shirt with your wave on it. Ah, it's interesting. Okay, we'll have a look. I'm trialing this thing called Teespring. I don't know if I haven't checked if it's live yet. It might be, and maybe we'll put some T-shirts and mugs and pillows on something. Just like stuff on there. Lorraine, what else is going on here? Don't squeeze a sty; it will spread the infection immediately. So yeah, styes they just cause this massive redness across your eyelids. They will go puffy. You get something called blepharitis, and you need like either a topical ointment, like chloramphenicol, or some flucloxacillin, which is an oral antibiotic. Yeah, a lot of people having issues with sty. So, right, now the time has come for us to switch over to the main channel, because what we're going to show you next is going to blow your socks off. We're going to see, it's probably the biggest cyst in the world. A very, very large cyst with an amazing amount of content. I have to say it put up a good resistance in terms of coming out. I had to switch places with the cameraman to get a better angle on it. But in the end, it gave up and it came out, and it did it all on the reel. So till next time, I'll see everybody on Wednesday at 21:30 GMT time. Work it out wherever you are in the world, whatever 9:30 PM GMT is. Till then, take care. I'll see you later. Enjoy. We'll do the live chat later.